Yes, I am super excited to introduce this morning's presenters. We're going to hear from the Massachusetts Department of Mental Health. Presenting for us today is Heidi Holland and Isabel Marchand. And with that, we can go ahead and get started.
Good morning, everyone. It's morning here, about to transition to afternoon, and Izzy and I are actually going to be at the same desk, so I'm going to move over there.
Morning, everyone. My name is Izzy Marchand. I use she, her, hers pronouns here with Heidi today. And we're really excited to present about Reframe the Age.
So thanks so much for having us. We're thrilled to be in Utah, virtually anyway. I was actually there in February, and it is one of my favorite states, both in terms of your gorgeous mountains and environment, but also your really friendly and warm people. And I did get a chance over the years to work with Ming Wong about transition age youth policy, and have just been so inspired by all the work that you're doing, both in the state system, and then from what I heard yesterday, what an amazing panel and what amazing speakers, and thank you so much for having us. So I'm Heidi Holland, Director of Transitional Age Youth Services at the Massachusetts Department of Mental Health. And I believe Izzy introduced herself already, and we decided that we want to be together on the same screen. We're also at this point modeling adult, youth, young adult collaboration. So we're going to talk really about two topics. First is our policy in Massachusetts called Reframe the Age, which has really given us an opportunity to look at our clinical systems, which are a lot of them based around age and what barriers that has. And secondly, about our Young Adult Access Center model that we have created really to fill in some of the gaps that young adults are experiencing. Okay. So just to give a little background on the Massachusetts Department of Mental Health. So we are the state mental health authority, which means both that we provide some services, and we also consult with other state agencies and throughout the state on mental health needs, gaps, and messaging for the residents of the Commonwealth. We have about over 3,000 staff. Our operating budget recently reached $1 billion a year, which sounds amazing. We should be able to do everything we need and want to do, but that's not always the case. And so we operate services for both adults and children, youth, and families. So as I mentioned, mental health authority doesn't mean just service operation. It also means collaborating with child welfare, Department of Youth Services, Department of rehabilitation services, and others. And we have really specialized services for children and youth. Those services really focus on, specific needs, both for youth, families, and adults. Okay. So I think we can go to the next one because I said that already. I just wanted to give you a sense of the kinds of services that we are providing. So they, in terms of youth, we include services that really focus on case management, day services, therapeutic group care. We actually do have a therapeutic group care also specific for young adults. We have PACT, and we also do some residential treatment, facility-based treatment. That is a small minority. We're very committed to serving youth and families in the community. So we'll go to the next one. And our adult services are similar, and they really focus on, again, really working with people in the community towards, positive life functioning, with both clinical treatment, but also look at employment, living situation, and other parts that really help to improve quality of life. So I wanted to start with both our youth and adult mental health services to really illustrate that we have silos, and I think that might be familiar to folks here from across the country. So we don't have a department of young adult services. We do some things that are specific for young adults, but it doesn't meet all the needs. And so I think this illustration kind of symbolizes that. I think it's probably something that you all have seen in your own states as well. So I'm going to move on to just tell you what we've been trying to do to really look at this gap. So, okay. So in 2018, we changed our regulations to really look at the cutoff for youth and family services and adult services. And this came as a result of, there was many years of discussion. We had a lot of input from young adults and families to say they're falling in that short silo. They were in between our services. And so we had a work group within the Department of Mental Health. We had a commissioner who had come from Youth and Family Services and was very committed to seeing some change. We also really wanted to look at the permeability between our child, youth, and our adult service system. And so just doing a regulation change has really also resulted in some practice change. So just to say again on the next slide, which is we call the process Reframe the Age. So the service authorization, which is who gets admitted, who gets authorized to participate in Department of Mental Health Services. That process left a lot of older adolescents falling between the cracks. And so our child, youth, and family services ended at the age of 19. So at that point, either they had to go into our adult service system or in many cases didn't qualify based on their diagnosis. The regulation change allowed them to remain in our service system until their 22nd birthday, if they still need the service, regardless of their diagnosis. And it also, one of the other goals was that perhaps they need, because we don't have a specific young adult service system, some services within child, youth, and family, some services within our adult system. And so that's where you see the little Venn diagram there, where they're really able to have a more permeable participation within a wider variety of services. So in the work group, we really focused on best practices, and we have membership from both our adult and child and family system, and the group worked to develop an implementation strategy. And we developed 2 guiding documents, which were both guided by the work group, by national best practice, and we probably should have, and today's summit really makes me think more about how we could have had more input from youth and families. There was a lot of input from youth and families around doing the regulation change, but we didn't probably get quite enough input on the implementation. And so that's a space of learning for us. We have 5 different area offices at DMH, and each area office developed their own implementation plan. That's a lot of how we work in Massachusetts, is that the 5 areas really drive what happens on a day-to-day basis. Where a central office, where Izzy and I work, we really guide the process. So the 3 areas that we've been focusing on are service authorization. So what qualifies a youth or young adult to gain access to our mental health services, service planning and provision, which is what are we offering, and service completion, what's the transition look like? That's okay. And so I think what's really important to know is that even though our budget is really big, comparatively to probably a lot of other state agencies, our clinical services are designed for those who are at the highest level of need in our state, where that need isn't going to be met by their insurance or other mental health services in the community. And so not everyone who applies to participate in DMH services is authorized to do so. When they're not authorized to do so, we guide them towards another comparable service. If they're on Mass Health, our state Medicaid program, if they are, are able to access another service in the community. We recently rolled out community-based behavioral health centers all across the state. So not everybody with a mental health challenge needs a DMH service. And that said, there are a lot of people with a high level of critical need. And so we really want you to look at our service authorization to make sure that young adults were not being excluded from being service authorized because of the more rigorous criteria for adults. And so that's one piece. The second piece is once they're authorized for a service, what does our planning and provision of that service look like? What is it that we can offer them? Are we able, as I said earlier, to offer them both a combination of services from our child, youth, and family and adult system? What is it that we have? We do have some specialized young adult services, but I think as someone said earlier about the needs for specific young adult transitional housing, for example, we could definitely use more of that as well. And service completion is like, what does it look like next? And we'll be looking at all the domains, not just their clinical needs, but housing, education, employment, et cetera. Okay. So actually, did we get to the, I think we missed one. Yeah. Oh yeah, go ahead. Yeah. So we are getting feedback from our 5 areas as to what's working well and what's not working as well. I think the service authorization piece where we've got clinical staff from the Child, Youth, and Family Division and the Adult Division working together when it comes to young adults to understand their needs in this process. I think that's been the biggest strength. And I think some of the challenges have been that we don't have enough services that are specifically geared toward young adults, especially if they have co-occurring mental health and ASD or co-occurring mental health and substance use. We are not quite at the point where we are able to really focus on every single one of their needs. And we do need to strengthen our system. And there is more work around that as well. And so I wanted to just show you all that, in fiscal year 19, which is really covering a lot of pre-pandemic time because it's July 1 fiscal year start. We were serving about 1,344 young adults between 18 and 21. Like many states, those numbers dropped during the pandemic. It was really hard to engage youth, young adults, and families. We learned a lot about telehealth. The engagement started to increase again. And last fiscal year, we saw about 1,309 young adults. And I want you to keep that number in mind when Izzy is speaking about the young adult access center system that we've also created over this same time period. As you see, young adults are participating in both child, youth, and family and adult services. I think we had assumed that that number in adult services would go higher once we did the Reframe the Age, because there are so many needs that young adults have that are really offered within our adult system. And so we're really trying to understand more about why not that might be happening. So before I hand it over to Izzy, I just want to give a little bit of context, which is that one of the things, as I'm speaking, you notice that we are self-critical, right? We understand that we've accomplished some really good things, regulation change and practice change. And there are many, many, many more needs for young adults around mental health. And not all of them rise to the level of our service authorization criteria, whether it's our child or our adult criteria. And I think one of your speakers yesterday, the man from LA, also mentioned that many young adults and youth would prefer peer support than clinical support. So one of the things we've been working on over the last several years, we've gotten a lot of support from SAMHSA, both System of Care and Healthy Transition Funds, is to develop a system that doesn't have these barriers, that doesn't have the barriers of service authorization, of needing a diagnosis, of needing an appointment, of dealing with our bureaucracy, which can do some good things, but hasn't been able to meet everyone's needs. So somebody who's been very involved in the development of this model is Izzy. And Izzy is going to talk about our young adult access center model.
Hello again, everyone. I realized before I forgot to mention my role. So a few months ago, I started at Department of Mental Health as the statewide youth/young adult peer coordinator. And prior to that, I actually was working as a peer mentor in one of our young adult access centers, using my lived mental health experience to give back to the young adults that we worked with and to share, provide support, share resources. So I'm very excited to talk to you all about the access centers. I'm very passionate about them and the work that they do. And so what do you find at an access center? An access center, it's like a community center, specifically for young adults. The age range may vary, but it's usually around 16 to 26. And at these centers, it is a community space. The emphasis is on community. It's not your traditional clinic. It very much feels like a home. It's very welcoming. There are oftentimes kitchens. You might see art on the walls. There's amenities like laundry machines, computers, and things like that to meet folks' basic needs. Some even have showers. So there's also information and resources. Access centers are very connected to the community and develop strong partnerships with other organizations in the community. Some examples are like food pantries they may partner with to be able to provide food in the kitchen at the centers, but also food that folks can take home. Some have clothing donations, hygiene products, harm reduction products. There's a lot of social spaces, couches, games, recreational activities, art, ways that young adults can get involved and build community with each other and express themselves. So that's kind of some of the amenities that they may have. There's like group opportunities for social connections, as well as peer mentors work one-on-one with folks. If someone wants to work one-on-one with a peer mentor to work on their goals, and all goals that are worked on, the young adults come up with themselves. The young adults, in the access centers determine their own treatment path. They decide as much as or as little as they want to participate. There's no requirement to come in at any certain time or any certain amount. Folks can really come and go as they want to. Like I mentioned, there's the connections to the community resources, community events, and there's also opportunities for leadership. And there's a real emphasis in the access centers of youth voice that is incorporated into every aspect of programming. And I could talk a little bit more about that as well. So young adults are able to explore their chosen paths at their own pace. There is no requirement, like I mentioned. Folks can work on their goals as they please. If they want to work on something one day and the next day they want to just come in and relax or just talk to someone and get peer support, they can do that. They don't have to be working on something all the time. They really can determine their own path and their own treatment. And it's really important that access centers are staffed by young adult peer mentors who have their own lived experiences of overcoming mental health challenges, of navigating these systems of care, and using those experiences to not just inform the work that they do, but to share with young adults, this is what I've been through, this is my journey, here's what worked for me. It may or may not work for you, but regardless, I'm here to be with you on your journey. One of my coworkers used the metaphor of like being in the driver's seat. The young adult, the young person is in their driver's seat, and the peer mentors are sitting next to them. They're not driving the car, but they're, helping out, just pointing out like, hey, maybe we turn there. But the young adults are the drivers and get to determine where they go, how fast they go, what direction. So young adult voice is the driver. It's infused throughout the model. The access centers have youth councils where it's usually about once a month. Young adults are able to provide feedback on the programming, the services, the structure, hours, activities, everything that goes on in an access center is shared with the young adults, and they're able to provide feedback. For example, a lot of the access centers have adjusted their hours based on young adults saying like, hey, you know, we would love to see the center open more after school hours because we can't come when we're in school. And so the centers have adjusted in that way. And as Heidi mentioned before, all of these services provided at access centers are low barrier and flexible. There's no requirement for service authorization. There's no need for a referral. You don't need insurance. You don't need a diagnosis. You don't need to show identification to walk in. You can walk in, talk to someone, and, you know, immediately get connected and become a part of a welcoming community. In that manner, young adults who have been systemically excluded are prioritized. And along with that, access centers are really integrated into their community and the communities that they serve. They're located in different areas of the state. And one thing that we've noticed as they've developed is each center kind of has its own culture, depending on, you know, where it's located, who is staffing it. For example, there's some access centers that really see a large population of young adults who identify as LGBTQ+, and really have a strong connection with that community. There's also access centers that serve Spanish-speaking communities, and in this manner, innovative practices and policy are embraced. The satisfaction with services. So as part of being on these grants and working with SAMHSA, there's satisfaction surveys, and young adults have really expressed that they are satisfied with the services that they receive. And, you know, young adults are very honest. We are very honest. We don't hold back. And I think it really speaks to the quality and their genuine satisfaction that they are reporting, that they like the services they receive, that they would come back. And that is also shown in the numbers, which we'll get to in a later slide. So for our listing of young adult access centers, if you want to learn more about them or visit any of their social media or websites, we do have a website called Speaking of Hope. And on Speaking of Hope, there's the locations in Massachusetts for all of the access centers, as well as contact information. But I want to go back to the numbers of unique young adults engaged over time. So access centers have been developing across the state. We've seen the numbers of centers and programs developed increase. And as they've increased, we've seen an increase in the number of unique young adults who are coming into the centers. So I just wanted to bring us back to that number that Heidi mentioned before of about 1,309 young adults receiving DMH services. And noticing that for 2023, seeing this number of 1,294, you know, basically equivalent to the 1,300 that we noticed before. So equal amount of young adults are engaging at the access centers and these low barrier services, as well as DMH services. And then to further emphasize that the total engagements, and an engagement is like a young adult coming into the center one day. We're noticing that if you look at the number for 2023 of 13,000, that is basically saying that the amount of young adults are coming in an average of about 10 times. They're not just coming into the center once, you know, they're coming in multiple times, they're engaged, they're involved, they are enjoying the services that they're receiving, and they're making meaning and making connections and coming back. And lastly, I will leave you all today with a quote from one of the young adults who is from our centers. And the quote just emphasizes how they were helped and by the support that they received from the peer mentors that they.
So we have our contact info there. We went through this like a lot faster than we anticipated, but one of the things we did is we took out some slides, because one of the things we want to do is the panel is so impressive is we want to have a dialogue with the panel. And so we wanted to really just engage in that dialogue. And maybe we could take the slides down.
Sure.
So one of the things Izzy didn't mention is that she's worked in 2 of those centers as a young adult peer mentor, and really has seen this field emerging, both access centers and young adult peer mentoring. And one of the things I've observed from a state perspective is that young adults have influenced our policies and practices. We have a young adult council, statewide young adult council that we go to. And so when we were procuring, which means putting out a proposal for agencies to develop new access centers, we went to the young adult council and we said, what should these spaces look like? What works for you guys? And so they provided a lot of input into that. And then just going with the theme of your summit, as I mentioned earlier, it was young adults and their parents that really pushed the Reframe the Age policy, but the place that we might have fallen short was their input ongoing in terms of the implementation. So at that, I think we want to open it up for question and dialogue, and just kudos to all of you and the amazing work that you're doing in Utah and other places in the country.
Yeah, I was just going to say thank you, and I can kind of start this. So, yeah, I think we'd really love to have this open dialogue. And so with that, I think I'm going to open it up to my fellow panelists if they have any questions. And then from there, I think we can go to audience questions as well.
Yeah, so thank you so much for your presentation. I really appreciated it and think that, yeah, the youth that you're working with are very fortunate to have advocates like both of you in this space and field. One thing that I wanted to talk about was your slide on the care centers or the access centers. There was a slide that mentioned that there were like a focus on prioritizing systemically excluded populations. So I was curious if you could share a bit more information into the actual practices or protocols in place for doing that. I think that is kind of like the next step of mental health work, of thinking around the specific populations in the historical justice-oriented sense. There seems to be like a disconnect in many of the places that I've been in, so I'm definitely curious to see how we can, the audience members and myself, can learn more around just like what does it mean and like what does it look like in practice to prioritize systemically excluded populations, or like how does it work within your setting?
Do you want to start?
Yeah, I think we can both speak to that a bit. So one thing that I have heard from young adults at the centers that really, made them feel prioritized and welcome was hiring staff from the communities that the centers are located in, as well as staff whose identities represent the communities that they serve. As well as hiring staff who are bilingual or trilingual to communicate with young adults in their languages. And that, also embracing practices that are innovative for things like outreach. For example, one thing that I can think of is at one of our centers, there is a peer mentor who has done outreach at like local laundromats. They've also done outreach at like local grocery stores, and making sure to be connected to areas in the community where young adults are working, are going to school, and making sure that they're connecting with young adults in those ways, as well as using social media to connect with young adults.
Well, I wanted to also mention, like, on the policy end of this. So, our centers reach predominantly BIPOC young adults. in some centers, the majority of young adults are actually Spanish as their preferred language over English, and we also engage large numbers of LGBTQ young adults. So these are not young adults. When I talked about the traditional clinical DMH services versus the access center services, and I'm not trying to say one is better than the other, they meet different needs, but we don't see them in our traditional clinical services to the same extent. We have embedded within procurement, so when an organization applies to start an access center, that they prioritize populations, that they have policies that really embed diversity, equity, and inclusion, and that they have an understanding of what are ways that we can really engage LGBTQ youth that are meaningful for them, and we model that in the sectors, and we try to model that in the state level as well.
I think also the low barrier component really allows for folks who have been historically excluded from accessing services, whether that be due to barriers like insurance or transportation, or just feeling unwelcomed and unsafe in traditional spaces. The centers are very welcoming in that, like, as soon as someone walks in the door, it's not necessarily like, who are you? What's your insurance? What have you been through? It's like, hi, how are you feeling today? Can I get you some water? Can we sit down? Do you want a snack? What's going on today? Just providing a comforting environment where humanity is embraced, as well as, working with young adults, meeting them where they're at in terms of things like, if transportation is a barrier, working with a young adult to make sure that they can get the transportation that they need. And, if they're facing barriers in their life, working with them to find ways around those barriers.
Yeah, thank you so much. I really, resonate with that and appreciate the aspect of meeting people where they're at. I think that is a critical piece of just providing care and support for people in general, of thinking around the recruitment process where not everyone, again, like as you both have mentioned, like has access to those opportunities or places and everything. So bringing that to them, and then also when it comes to thinking about these services and policies, of ensuring that when we center the most structurally and historically disadvantaged populations, literally everyone benefits from it, because you're filling a lot of the gaps that are being met. So I think that is something that I hope the rest of the audience is able to learn from as well, because that is a critical piece of where we need to go for our next steps of the future of mental health and well-being work and youth development and transitional age youth. So thank you so much for all of your work, and I'll pass along to the additional panelists.
Yeah, thank you so much for that presentation. It was very insightful. And I think the idea of the Access Center is very cool, and I'm not sure why other states across the country don't have it. So I was wondering if you were aware of any challenges that would prevent the implementation of such a Access Center in like other states, and if so, what advice would you give to other departments or other states to be able to implement an Access Center such as this?
Yeah, so there are some other states that do have centers that we've learned a lot from. I think Kentucky is one. Some other states that you might not expect, that they have been at the forefront also of starting these spaces. I mean, the biggest challenge is always going to be funding. We've gotten a lot of support, as I mentioned earlier, from the federal government through SAMHSA, but that helped us to start a lot of centers, and the state is now sustaining and expanding the network of our centers under state funding. So we're very fortunate, in that this, young adults are really viewed as a priority right now, in terms of, the perspective of who's really been impacted by the mental health crisis. I mean, I think young adults were always disproportionately impacted, but it's gotten a lot more attention right now. So I think, that, primarily, I think you could look towards applying for federal grants. You can look towards your state. And then, there are some spaces that are opening up with private funds, and that, they have donors. So we have Massachusetts, in addition to being like a coastal state, we also have several island communities. One of them is Nantucket, and it's pretty isolated out there. I mean, not in the summer when it's vacation time, but definitely in the winter. And there are folks there that started a similar center through private donations. And so I think it's really going to depend on understanding the resources, both within your state, federal government, and then philanthropic folks.
Yeah, this is all very new. So like as more centers are being developed, we're learning from their successes and their challenges, kind of live as it goes.
Yeah, well, thank you. I appreciate that, and I hope more states are able to get that funding because I think it is very necessary, especially with the humanity aspect that you mentioned of just sitting down, taking a moment to just connect with a person on a personal level rather than just trying to get money from them or trying to fix the solution right away, or fix the problem right away. So thank you.
Thank you.
Thank you again for your presentation. As a Rhode Islander, I love seeing the work that Massachusetts is doing, and I'm not sure if Rhode Island has the same youth access centers, but if we don't, I hope that we can follow in Massachusetts' footsteps and implement something like that soon. But I just wanted to ask you to expand a little bit more on what the transition age youth work group looked like within the Department of Mental Health. How you recruited people, what exactly the members looked like, etc.
Yeah, no, this is a great question. The work group really reflects how we're going to implement the Reframe the Age policy. And the folks who implement the policy come from our 5 area offices. And each area office has a lead child, youth, and family person and a lead adult mental health person. Those folks were really critical to helping us develop the implementation plan for the policy because it really happens through their 5 offices. And then there have been other people who've been involved. But if I told you that young adults are not on that work group. Okay, I want to just be honest and transparent about it. It is, one of the things that we do in the state. I mean, we do meetings really well because this is like how you function every day is like, let's meet about this and make a plan. But we don't always do like thinking through who else needs to be at the table. And so where we do get young adult input is through our statewide young adult council. And I would love to have their input throughout, not just when we're like ready to bring them something. So it's something that we're learning a lot more from Kira, and invite you to visit one of our centers. We've got one in New Bedford, which is like really close to Rhode Island. So would love to see you down there. So get in touch.
Yeah, definitely. No, I'll have to come check it out as soon as I get home. And thank you just for recognizing the work that you guys are going to do in the future.
Thank you.
Yeah, thank you for your presentation. I think that this is really great work. I was wondering with the Access Center and like other services that are aimed towards youth, how do you ensure that they still are receiving services once they age out of that eligibility?
Oh, Ray, I wish I had the like golden nugget answer to these questions, right? It's a really ongoing thing. I think one of the challenges within the state system is that, it's not just our silos between child and youth and adult services, it's our silos between our different state entities where youth and young adults do age out of care. And so whether it's our child welfare or our juvenile justice system, it's a little bit different within the Department of Mental Health because we're not a custodial agency. Folks are participating in our services willingly or with the support of their family. So it's a little bit different, but I would say that we are trying to build in warm handoffs and more integration with all of our youth serving systems around aging out. I think with the Reframe the Age policy, we moved the cliff a little bit for mental health from the 19 to the 22, but then we're still struggling on the 22 and over. And so I think one of the things that we need to understand and learn is that folks need services based on not just their clinical needs, but where are they developmentally as a youth, a young adult, and an adult, and what are their needs in those contexts. And it's an ongoing discussion. It's an ongoing challenge. Some of it is, bureaucracy sometimes creates these, to me, 22 or 26, like they're artificial, like it's just a number, but the state needs to do these things as far as managing budgets and managing their services and priorities. So I think we want to look at this very differently, just to sort of put age aside and look at people's needs. And we're working towards that. We do have a lot of resources for adults, for example, for housing vouchers, for adults with mental health challenges. And we're working to really see where can young adults get those vouchers? Like when a young adult ages out of our young adult therapeutic care, which is a staffed apartment, supported apartment, can they move on to a voucher? Because that's going to have, it's exactly what you said earlier, right? It's like that trajectory, right? It's like, we need to make sure that we're there at all points. So thank you so much for that question.
I can speak to the access centers a little bit as well in terms of like, I mean, they're called access centers because I think they're really access points to like other services in the community as well as like other connections in the community. So like it's really important that young adults who come into the centers, staff, really recognizes the importance of building upon connections they already have or connecting them more to other resources, other agencies, or even just, building upon their support networks of like friends and family, and schools, expanding those connections as well. And with some of the access centers, I think I mentioned before that they vary in age. So if one access center, for example, has an age cutoff of like 22, a lot of times what they will do is see if there's another center that is nearby that has a higher age range that they can refer them to. So that way it's kind of similar. But it is also emphasized in the centers of like if a young adult is coming in and they're near that upper end of the age limit, to be talking from the beginning of services like, hey, we recognize that, our age limit is here. So let's talk about what comes next and what's after, and really planning intentionally of what is that next step. Thank you for that question.
Yeah, thank you for your answers. I think, I don't think we have anything like this in Ohio that I know of, at least where in the area that I live. So I was curious, who could I go to try to advocate for something like an access center?
Well, that's a little complicated. I mean, if you mentioned that you're part of a youth advisory group, is that right, Ray? I mean,
Yes.
I think to get that group connected with legislators that might be able to get some funding over to one of your state agencies who could then procure the service. I think that would be a way to go. Use your voice as young adult advocates to say, this is something that we need. And if there's anything that we could do to share with you, Ray, please get in touch and let us know. But I think use the power of that group and try to, develop those allies in your state legislature and your state agencies. There's no reason that your group couldn't go talk to your commissioner of, and I don't know, it's called different things in different states, but your mental health authority, your child serving agencies, your adult serving agencies. There's no reason your group couldn't ask for meetings. And I think that would be a great way to start.
I just have one last question. I don't know how many answers you're going to have for me, but just because it's not your primary focus, but I know you mentioned that some of your services are more residential focused. And so my question with that is kind of like, what do those services look like for those youth in those residential settings? And then also, how are you ensuring that that voice is being heard? And then with the idea of like transitioning out or rehabilitation, how does the Access Center, or does it play a role in these youth that are in those residential facilities?
Yeah, no, really good question. I mean, I think it really depends on the person. Every person's situation is unique, you know, both clinically and their age and their connection or not connection to family and community. But I think one of the things, so for our children, child residential services, it is really about focusing on their clinical needs and then transitioning back towards the community to the extent that that exists for that child or young adult. And if it doesn't, what natural supports can we help to amplify? And for the young adults, so we do have a small number of programs, young adult therapeutic group care, that was developed specifically for young adults with mental health challenges. That sort of starts off as like a group living environment, you know, where they're together and they're staffed 24/7 and they're, you know, to have a schedule and they do meals. And that moves towards a staffed apartment where they have, like, they're in close proximity and it's not as structured. They're moving towards more independence. And then there's an apartment in the community where there are outreach workers who meet with that young adult at least on a weekly basis to make sure that, okay, so now that they're in the community, what is it that you need to help sustain this space? But as Ray mentioned, that, you know, we do age out of that service, I think, at 26. And then what? And so one of the things we're really trying to do is move folks towards a housing voucher, and because housing in Massachusetts is extremely expensive. Very few young adults could afford to do that on their own. And if not a voucher, you know, how do we create a community where they can develop relationships and do a group house with roommates, but to really move them more and more towards independence. Our child welfare system has a similar independent living trajectory. And again, you know, the challenges of how expensive housing is. So that after that program, where are folks going? We have huge concerns about that. We do see large numbers of young adults who've been involved in our systems who are experiencing homelessness, who we are really working hard to re-engage in a way that makes sense for them.
Awesome, thank you. I think we're now going to move into audience questions.
So first question is, I currently work at a place very similar to this, but the population we serve tends to be older. Do you have tips on how to get transition age youth in the door to get them involved? We aren't able to serve minors, but we can serve 18 plus and are having difficulty getting anything off the ground.
Sure, yeah. So 18 plus, we definitely recommend getting connected with like local colleges, local schools, local libraries. The library was a great point of connection in terms of like them offering community programs, being willing to collaborate. Yeah, any agencies that folks that are already in the community that you know are successful at engaging young adults, collaborating with them, learning from them, because I think every community has their own needs in terms of what works for them and what they're looking for in terms of services and community culture and trust with service providers as well. I think also social media is huge. I mean, if you're working with young people and you want them to know about what's going on, having a social media presence, especially a social media presence where young adults are involved in creating the content and putting out the content, even if it's just, you know, asking for feedback on the content that is being put out. Having a website is really, really important. Just to, you know, make for the legitimacy and building trust and getting connected with other community providers. I think that's really the key, is building like a network of folks who are involved in this work, because the needs of young adults, especially 18 plus post high school, there's a lot of different needs. So really building a network that can address all different kinds of needs, whether it's housing, whether it's education, financial assistance, like building that network is really helpful, as well as using social media.
Yeah, and just to echo on the social media, we have a statewide website for young adults that is not our standard state website. We asked for permission to do a website that was for young adults, and it's speakingofhope.org. It was actually started by a young adult who was part of our young adult council. He called it Hearing Voices, and then was helping us, kind of on the back end with that website for a long time, as well as social media. We have Speaking of Hope on Instagram and Facebook, TikTok, I think. And really to help us get the message out about the centers and all the resources that we have available in our state. And then that said, each center has their own social media presence, but we try to amplify each other in those spaces.
It also takes time, for outreach to work. There's usually not an instant turnaround with outreach. It can take a while. But I also want to emphasize the importance of really building quality connections with the young adults that are in the space already, because once you build those quality connections, I think we saw the most engagement once young adults had kind of received some support and felt supported so much that they went to friends and said, hey, I got help from this place, or I went to a group at this place. I had a snack at this place.
Yeah.
You should come after school. And
Mouth is huge.
word of mouth is
Yeah.
huge, especially with young adults, because of that trust piece of, are we safe here? Does our voice matter here? So building those authentic relationships with the folks who are already there.
It made me also think, Izzy, about the music that your young adults were doing at Youth Elemento, which is the center that Izzy was working with before we stole her and asked her to come here at the state. So there were some young adults who were, performing on the streets, like street performance, and they were really, really good. They didn't have a lot of practice space. That the city that they live in is very small, crowded apartments, and so Youth Elemento offered for them to come over. They've now built out a music room that's soundproof, and those young adults practice there. They're performing. They're getting gigs throughout the city to perform. They're an amazing, talented group of young adults. But starting with one of them, having other musicians come, that was one of the. It's like this organic thing. Is like, and it's so hard to explain how to make that happen. You need to be in the right place at the right time.
And being authentically invested in, like, we see you, we see your potential, and we're gonna use what we have to support you. It was just providing a space for them to perform, and from there, they brought more folks into the center, not just to see their performances, but they were able to say, like, hey, we were really supported by the peer mentors here, and we think that they can support you as well. So that was really key.
Thank you. Another question, just kind of a practical question. Wondering if you could share your strategies for financing the space and furnishings.
So you have to build it into your budget. So if Ray goes to the legislature to say, like, we need this, or to a state agency, we need it, and we need it funded well, so that it doesn't, one of the things we didn't want was the spaces to look like a sad clinical, space with, bad colors and old magazines. Like, that is not the space young adults want to come to. It has to be engaging. And in fact, they help with the design, like, what kind of furniture should we have? What should we paint the walls? What kind of artwork should we have? And they give input all along. So you've got to structure this into your budget, whether you're getting federal, state, or private funding, and structure it in generously. One thing that we've also seen is, like, location is so important, so if you're outside of town, not on a bus line, you're not going to get as many young adults in as if you're in the heart of, the community. On public transportation. And that said, one site that couldn't find a downtown space but has a really gorgeous space, they leased a van and their logos paint all over it. They pick young adults up from throughout the city. So
Yeah, I think also for like furnishings, as that's again back to the importance of having community connections and strong outreach and partnerships. A lot of the furnishings at the centers that I've been at were donated either by like folks in the community or within the like
business
nonprofit,
community too.
yeah, the business community as well. And yeah, again, the importance of having furnishings that make folks feel comfortable, that are homey, non-clinical. It also doesn't have to be super complicated. For example, when we were first starting out at the center I was at, most of what we had like a world map and we had some flags. But the flags are really important, especially the pride flag that we had up for just showing like this is a safe space. If you're part of this community, like you can walk in here and you will be safe here. And then, getting creative with like, we're going to create artwork and that artwork's going to go on the walls. So that also kind of shows young adults like you can contribute to the community in this way as well, by creating this space and making it yours.
Thank you. One more question in the chat. I know we're getting close to the end of our time. There was an observation in the chat just for you all to see. They said, looking at your sites, I find it interesting that they are named differently and seem to reflect each community of location. So some nice feedback there. And then a final question. Are there volunteer opportunities for those who age out to come back to the access centers and speak about their experiences and build community with those still in the access centers? And the idea of using that as kind of a metric to track progress and success.
I'll start and I want Izzy to, because she's worked at 2 centers, but I just want to say that one of the things that we really do, and you'll notice this, is that because our staff are most primarily young adults with lived experience themselves, that when you walk into a center, you can't always tell the difference between the young adult participants and the staff. And that said, several young adults who've been participants in the services have been hired. Young adult peer mentoring is a full-time paid role. They've been hired as peer mentors. And do you want to talk more about volunteering? Because I know you also have that as well.
Yes. I will say that when I was a staff member, I was frequently mistaken for a high schooler a lot of times. So, we very much are very close to the age range of the folks that we work with. And yeah, as Heidi mentioned, very recently, a couple of our centers have gone on and hired young adults who previously received services there who so not volunteering, but actually being able to apply for these paid experiences to give back and be a part of the spaces that they received support from.
And then, in terms of volunteering, I think it's just woven throughout. So young adults who are, part of these young adult access centers, they design the logos. So they lead the youth young adult council. And yeah, sometimes young adults who are a little bit older might come back to do a project or something with the group. But, it's a community that it continues to build.
I can think of like a couple of folks who but we were able to come back and volunteer for like some presentations, and we were able to kind of like sign off on their hours for their schools, for community service hours and such. So that is an opportunity for folks to volunteer.
Awesome. Thank you, Heidi and Isabel. I think this policy is honestly super inspiring. And I think my last thought would just be like, I love how this focus is more on like family and youth transitioning out. And I think it's super important because I think there's a lot of youth that slip through the cracks. And I think kind of what this policy is creating and helping with is assisting that dilemma. And so once again, I just want to thank you guys so much for your presentation today.
Thank you, Kate, and thanks, Utah, and really appreciate you all and what you're doing there.
Thank you all. It's really great to see the youth panel so involved and to hear all of you speak. So thank you for being there and being you.
Thank you.